This is SSN.
Story Studio Network.
I'm Tom Hoppe, and I'm your host of the Most Painful Podcast. In the last episode, we spoke to Leroy Ho about how to do proper strength training when you have chronic pain. Now, there are many resources highlighting the importance of strength training to maintain muscle, improve mobility, and help with longevity. However, what is the right way to strength train if you're suffering from chronic pain? Well, Leroy had some great tips, and if you missed the episode, you can listen to it on Spotify or Apple Feed. So we talk about chronic pain. Having access to good pain management and pain clinic is important to help someone who's suffering from chronic pain. However, if you don't have a pain clinic in your area, or you can't get access to a clinic, what are some other options available to help you with your pain? Today, I'm joined by Rosemary Wilson, who's with Queen's University. Rosemary, welcome to the show.
Thanks, Tom.
And also Racheal Bosma from Women's College and Toronto's University. Welcome to the show.
Thanks, Tom. I'm excited to join the conversation.
Yeah, I'm looking forward to it. Maybe Rosemary, you can start why this project was started and how it's going to help people.
Well, Tom, it was really interesting that the question that sort of underpinning this project came right from clinical practice. And we know that people wait a long time in Canada to get access to an interprofessional pain management clinic. And we were concerned about the fact that patients were sitting on the wait list, just, not having access to things that can help them. And we thought that would be a really interesting way to deliver some information to help people get ready. And we know from our clinical practice, mine and other colleagues that were involved in this project, that people were very frustrated by waiting. Sitting on the waiting list just contributed to them being more deconditioned. You talk about exercise, giving people the opportunity to be able to engage in exercise and engage in some treatment was really, really important. We noticed an increased reliance on medications for chronic pain for those that were waiting, and a big reduction in people's ability to cope. And, and there was progression. So, when we actually were able to see the patients, finally, there was a noticeable progression between what they were actually referred to in the first place and then what we saw when we talked to them and did an assessment when they came to the clinic. And another really interesting thing that we were noticing was that folks really weren't ready for the type of care we provide in interprofessional clinics. They were expecting a prescription maybe or a treatment during that initial visit. And they really were unprepared for many of the other things that we do that are educational and non-medical medicine related interventions that we routinely provide in interprofessional clinics. So we thought that was sort of a golden opportunity to jump in and provide some interventions.
Nice. And Racheal, I know you're involved in this project as well. What's your kind of angle or view in this project?
Yeah, thank you. It's really that clinical and that patient need. So we, as Rosemary described, we really heard, people are waiting, they're waiting a long time. I really care about how can we get patients access to care. And then this experience, they're not getting better while they're waiting. And Rosemary described this, and we had done some previous work leading up to this, and we asked about the waiting experience and about the impact of waiting. And so we know from a health perspective, health deteriorates, outcomes are poor when people wait, but the personal touch, the personal impact. And I think what really resonated, which really struck me, was that people were putting their life on hold while they're waiting. And when you're talking about a chronic disease, that's not a good idea. You might be living with this, and you have to learn to live well with this. And there's so much that you can do and that you can get support with. And we started thinking about why are people putting their life on hold? Why are they waiting to come into our doors and learn maybe for the first time that they have a chronic disease called chronic pain? And, we introduced for maybe the first time the concept of self-management. And that's a really hard thing to learn. And so we started thinking about, well, how can we plant seeds earlier on? How can we get resources into the hands of people? How can we help them learn about pain? How can we help them learn to understand and communicate their pain better? And it was actually one of your earlier guests on an earlier episode, so I'll invite you to reference back to that. But Dr. Abhi Sood mentioned the tension in primary care and getting access in primary care, and really this the tension around the shift of the burden to patients to self-direct, to be prepared, to come ready. And we see that a lot as well. This is this real shift. We want patients, we want to deliver in the clinic the best care possible, but the interactions are really time limited. And so there's a lot of tension around how do you make them impactful? How do you get the most out of your care? And we started thinking, well, how can we also help through this program get people ready, set expectations, help them learn about their pain, help them learn how to communicate about their pain, help them learn what kind of questions they can ask, what they can bring to their appointments to really get the most out of it. So that was some of the things that were really motivating us, that clinical, that patient need to drive us creating a program like this.
So when we talk about wait times, I mean, is this, I guess, first of all, is this research in Ontario only, or are you doing, is it out of the clinic? Which clinic? Is it out of Women's College? Is it out of the one that you're in, Rosemary and Kingston? Or is it more of a wider scope?
Well, it's in both clinics. This study that we did that we're speaking to you about right now was a pilot a feasibility study, so something that would help us to understand if we could actually provide this information to people waiting, and if it was acceptable to them, if it was meaningful to them, if we could recruit people to participate. And we also added a group that received some one-on-one virtual coaching from somebody educated in motivational interviewing, which is a really great sort of motivational coping method to help kind of bring the content home. And so we were really interested in looking at those two sites and see if we could actually make it work for those two sites towards other things that we could do with the program, perhaps a larger study that's more all the way across Canada, or build it into something else, which we'll talk about a little bit later.
So in Ontario, what is the wait time now if someone wants to get into a pain clinic on average?
Oh gosh. So I think it's pretty variable. We're actually doing a little bit better than we used to, but over the last sort of 10 years, it's been a year to a year and a half, sometimes depending on the jurisdiction, up to beyond 2 years. In our local site, we're doing better than we have been, but it's still, in excess of a 6-month wait, which I feel is unacceptable.
Yeah, because Rachel, like you're saying, this is a chronic condition, a chronic disease, and if someone's waiting for that length, then it just gets worse, right? So, what are some of the? I mean, you talked about education, but eh, maybe you can just kind of start from the beginning. A person now is identified that they're going to be waiting for a while. What are the first steps? Rachel, maybe you can start.
Yeah, what are the first steps? I think it's really around learning about your condition. And this is tricky because there's a lot of diagnostic uncertainty. When you're talking about chronic pain, it's kind of this, it's very complex and it's kind of this timeline. We know pain is a very healthy biological response. Pain is a really good thing. It's a warning system. When something's going wrong, stop doing that until it doesn't stop and until it's not helpful, until it's maladaptive. And that's a really, a tricky thing. Chronic pain can also be a symptom of something. So patients are trying to find, what's the root cause and can we address this? And physicians on the other side don't want to miss something, right? And so there's a lot of diagnostic uncertainty, but it can be a disease in its own right. So I think one of the pieces is learn about it. And then to learn about it is where do you go? So we're in an information age. And so we're talking about this program and we've curated and we've worked together to create, an evidence-informed and then tested and evidence-based program that provides education. But you can, Dr. Google, you can Google anything and you find 800,000 cures pointing to the answer, the solution, right? And so it's not just about learning, it's about knowing where to go to find trustworthy information. So I think that's one place to start. But then I think there's a lot of other places. So you can also start when you understand more about your pain. It's also how are you communicating? What other resources can you have access to? So we talk a lot about pain being very isolating as a condition. And so peer support, going to and talking to others who can understand the type of journey that you're on because they're on it as well. What works for them? Where have they tried? Where have they found support and resources? And really looking broadly at, we describe it in the program as like, who's on your pain team? This idea that, you're the captain, your doctor's not. They're one player on your team, and there are, maybe one that you don't see that often. So who else is on your team? What's in, to mix metaphors, what else is in your toolkit, so that you can kind of live out your day-to-day life towards your functional goals, towards, a life that you value. So I think there's a lot of different programs, there's a lot of different resources, and it's about knowing where to go. And so we've, as a result, kind of an outcome of this program, have tested. So we've developed this self-management program, and we found that it's useful and it can be used. And then the next step is, okay, so now where does it live? And so to launch into another thing, getting away from your question, Tom, but something that we're really really motivated by, is to make sure that this program is useful and used for Canadians who are impacted by pain. So going that one step further, and I'm going to drop another resource, and that's called the Power Over Pain portal. So if you're interested, if your users or your listeners are interested, poweroverpain.ca will bring you to a portal, adult side, youth side, where we've integrated evidence-based resources for this purpose. Understanding that, if people are going to learn about their pain, if they want to take, courses, if they want to get peer support, if they want to have counseling, if they want to have access to all of these resources, it needs to be trustworthy. It needs to be what they want, when they want it, understanding that everybody has different capacities. So that portal, poweroverpain.ca, really integrates these evidence-based solutions. And this is where our program that we've developed and tested now sits. There's a lot out there. It's about knowing where to find it. And we've tried to make that a little bit easier for people.
And we recognize that people who experience chronic pain it's exhausting experiencing chronic pain, and spending the time searching the internet for that special solution, that is also an exhausting kind of activity, and being able to get access to something like empowered management on Power Over Pain and all of the wonderful resources that Power Over Pain offers, I think it's a real good intervention for both clinicians to provide to patients and patients to access on their own, and they can discuss it with their clinicians as well, to make sure they're getting the most out of it. But it's a really, really good resource for people who suffer.
Yeah, and it depends where you go in the country. There's different things. Like I know in BC we have Pain BC, but then we also have, under the provincial healthcare, they cover group virtual medical visits, and so you got fairly large clinic like Change Pain in BC here, where they have the online education, which is a doctor run and is covered by MSP. Same with mindfulness, and so there are, I don't know if that's available in Ontario as well, but there are evidence-based information that's available in certain locations. But I agree with both of you, is that there's so much information out there. What is the right information, and what, because as we know with Google, we can always find the information that we think is the right information versus what's evidence-based. So that's what we've always tried to do on this program, and as well with other things, is try to get evidence-based information. So you talk about community. How do you do that in a virtual setting? So if I understand your program correctly, and I'm just trying to lay it out for the listener as well. So I come in and say, okay, I got a 2-year wait or 6-month wait to get into a pain clinic. I'm going to go onto your website, I guess. Is that how it is? Or am I linked to a clinic that provides the virtual education? How does that process work? And then I'm going to get into community after you answer that question.
I think both things are true. In many clinics, such as the one that I am fortunate to practice in, we provide poweroverpain.ca to people who are initially registered with the clinic, so they can have access to that information. Other clinics, like those in BC, for example, have online self-management programs that people can access while they're waiting. I understand. So, I mean, it is a golden opportunity, as we've mentioned, to kind of intervene in advance. I think I understand. If that's correct, Racheal, and tap me, you have something similar.
So and then so I'm coming in. I'm going to tap into the program that you're talking about. How do we build community? Because we know like to give a bit of context to the listeners. Like if we look on the veteran side, we just finished an alpine program that we ran, and the big part of that was community education was huge, and we developed community. And of course, with military too, one of the issues with chronic pain management is the military mindset and identity. It's a gap that is there that needs to be addressed. We developed community, and we did it virtually, and then we came together. How do you develop community in your program? Like, am I coming in, if I'm a patient, am I coming in with other patients, or am I just doing it on my own, like a correspondence course, for example? And if that's the case, then how do you develop community?
I think if I can speak to empowered management first, and then Racheal, maybe you could speak to the powerofapain.ca. In empowered management, in the project that we undertook, we actually had coaches to kind of work with the individuals. And although we had some great comments about the inclusion of coaches and that sort of back and forth conversation that they had, we didn't see any particular benefits in the outcomes. The findings were not particularly robust. But what we did hear from our participants in our feasibility study was they very much appreciated hearing from the people with lived experience and the videos that were on the empowered management site. And they did talk to us quite a lot in the interviews about the importance of peer support and the benefit of for them of discovering that they weren't all by themselves in the things that they experience within their chronic pain journey. That, I think, sort of leads us to future work that we may do to really incorporate peer support into some of the work that we do. But Racheal has other things to add about the bigger project.
Yeah, I was going to touch on that too in terms of tapping into future goals. So as Rosemary mentioned, we really took it from a coaching perspective, thinking that if people have access to information, well, then they might have questions and that motivational piece. But finding that, a one-on-one clinical coach didn't really nudge that needle in the same way, but saying that people don't, while it's self-directed, they really liked accessing to the information and the education piece, there was still that community piece that they were looking for. So you're exactly right. We're looking to say, how do we integrate something that might be self-directed and could be asynchronous? You could go and learn about it and then come together, and it could be a discussion forum, it could be a support group, etc., and really kind of integrating the two models. So that's something that we kind of have our eyes on for future work within now our program. So the empowered management, the self-directed piece of it, so the modules, the online, you can take a look at them. There's a series of 8 modules, just to describe the program a little bit. It walks you through setting expectations, what is chronic pain, factors that influence your pain, how to be empowered, like what are strategies, self-awareness, compassion, acceptance, exploring your values, and really ensuring that what you're trying to do in your day-to-day life is aligning with those and your value-based goals, and then communicating pain. So that's the series that walking you through the series of the Empowered Management Program. That program now lives on the Power Over Pain portal. And within Power Over Pain, you can look at, hey, I want to learn about my pain. I want to take a self-directed course. You can look Empowered Management. But also on the portal is, I want to connect, or I want to talk to somebody. And Connect puts you in contact with peer support groups that are happening across the country, recognizing that mutual support model is so important, that isolation factor. I think, Rosemary, one of our key findings in this was really just that the material resonated, because hearing the captured interviews of people, recognizing that they are experiencing something that other people are also experiencing, and that there is kind of a path through and a path forward, was so empowering to them. And so I think really having that in a community setting is so critical. So there is access. It's not currently linked to our program per se, but that's something that we're looking forward to integrating in future work.
Yeah, and I think the message that we're getting here today, and we've heard on many other episodes, is it's about education, right? It's knowledge and understanding and what you can do for yourself. So, I mean, if somebody is going through your virtual program or they're starting to learn, how does that, if they're still waiting to get in the pain clinic, but say they're seeing other allied health practitioners, chiropractors, physios, who are not working with the pain population, they're outside of outside of a pain clinic. How does that link with the information you're providing? Do you give information to people that they could maybe use to talk to their allied practitioners to maybe help them while they're waiting to get into a pain clinic?
Yeah, absolutely. And that's actually, in my opinion, the one of the real key pieces about how this might be useful. It gives people experiencing pain, chronic pain, to the language they need to be able to talk to providers of any specialty. I'm experiencing this. It feels like this. These are the descriptors that I have. This is how it affects my function. This is how it affects my quality of life. And to be able to talk about that in a meaningful and sort of measured way in a clinician patient relationship is really, really important. And I know that some of my colleagues, and I do it too, we have when we have our ask our patients to access some of these resources and then come back and talk to us about what they've learned. And it's both beneficial for me as a clinician, and for the people I have the good fortune to care for, because we both learn something about the pain journey. And I find that it really helps them to move towards that positive trajectory of good self-management and good pain coping, because we're both singing from the same play sheet, if you will. And I think it helps me to understand how pain impacts somebody's life in the particularities of each individual's experience. And I think whether we're pain clinicians or not, that information is very, very helpful. Like in primary care, in massage therapy and chiropractic, as you mentioned, we're all trying to help people restore their health, right? And so everybody wants to work together to that end. And so if our patients, our people experiencing chronic pain, can bring that to the encounter, then I think everything's going to be moving in the right direction.
Yeah, I think I agree with you. And I mean, in the work we've been doing and some of the research projects we've been involved in, I, that is key: is self management, understanding pain. Especially if you look at veterans who come out of the service, they have no understanding of chronic pain, and they're kind of just working their way through the mud to try to figure out where to go next. So things that your program will definitely help people like that. So as we're closing off here, I'll start with Racheal. Just two takeaways for the audience.
Sure, thank you. I think one, that self management doesn't mean that you're by yourself. And it doesn't mean, non medical. It means really understanding what tools are available to you and seeing each kind of profession as offering something, a coping skill, an intervention, something that can help you, and knowing that that's a tool then in your toolkit. And sometimes that tool will be so helpful. Sometimes going to that physio or that massage or getting, having that medication, that's really going to be what helps you along your journey. And sometimes that's not. You need to turn to other tools and so it's about building that out and having that well-rounded toolkit. And so, but it doesn't mean that you're by yourself. It does mean that you're kind of holding those pieces and you're kind of looking at what's in my toolkit, what do I need to use today? And so I think that's absolutely critical. I think the second thing is to really encourage people. We've moved away from this, kind of clinician model. Everybody has access to so much information. It's overwhelming, but there's hope in that because there's a lot available to you. So I think encouraging everyone to take a look at poweroverpain.ca, to go to trusted sources, to advocate for yourself, and to ask questions about how you can advocate for yourself, so that you can get the most, build that toolkit, and have that kind of rich care experience.
Yeah, no, for sure. Advocating for oneself is key, especially when you look at clinicians. They do the best they can, but they got a full plate as well. So knowing what you need and reminding them is helpful. Rosemary, a couple takeaways from you.
Adding to what Racheal said, I think that one of the biggest things is when you're ready to go see a clinician for whatever reason, make sure you're clear about what your expectations are, and negotiate your expectations with the clinician so they know what you want to achieve out of encounters with an interprofessional chronic pain team or even primary care team. So I want to be able to ride my bike, or I want to get back to work. These are all key things to have in that conversation. And I guess a takeaway plug. Our research was funded by the Canadian Institutes of Health Research, and we got a Catalyst grant And a key takeaway is I'm very grateful for the research money that we get for these projects, because without them, we can't generate the evidence we need to make the people that we have the privilege of caring for better and moving them on to more functional lives.
Yeah, 100%. And I think, we have the portal you've been talking about, then you got Pain Alberta, you got Pain BC, we got other interdisciplinary clinics like Change Pain and the one in Kingston that you're at, Rosemary. So there's lots of places that people could tap into for knowledge that's, like Racheal was saying, is evidence-based. So you're getting good knowledge.
Absolutely.
No, it's great discussion. Thanks, Rosemary, for being on the show, and Racheal as well.
My pleasure.
So in our next show, we're going to be talking with Luc Hubert, who is our French host for the Most Painful podcast, and we'll have Hélène Le Soulaire on the show again, and we're going to talk about women in the forces and how chronic pain affects them, because the latest research is showing that women suffer from chronic pain in the military more than their male counterparts. So that should be an interesting discussion. For feedback about the show, or if you want more information on chronic pain, and we're talking about where you can get information on chronic pain, the Chronic Pain Center of Excellence is for veterans is a good website that has a lot of evidence-based research on it. And you can visit the website at veteranschronicpain.ca, or you can follow us on Facebook and Twitter at Chronic Pain COE, and on Instagram at chronicpain_COE. So once again, Rosemary and Racheal, thanks for being on the show.
Yeah, thank you so much.
Our pleasure.
And to everybody else, stay safe and keep the hope alive.
The Most Painful Podcast
is produced for the Chronic Pain Center of Excellence by Story Studio Network and Eye Contact Productions.